This is from chapter Disorders of Menstruation, page number 343. First question, AIMS. This is from AIMS, May 2006. First question, 13-year-old young girl presents in the casualty with acute pain in lower abdomen. She has history of cyclical pain for last 6 months and she has not attained her menarche yet. On local examination, a tense bulge in the region of hymen was seen. The most probable diagnosis is options are Mayer-Rokitansky Custer-Hauser syndrome, testicular feminization syndrome, imperforate hymen, Asherman syndrome. And the answer is imperforate hymen. A young girl who has not attained a menarche but has history of cyclical pain for last 6 months, presenting to casualty with acute abdomen and on examination a tense bulge in the region of hymen, clearly points towards imperforate hymen as the diagnosis. Let's learn about other options later. Now let's look into the topic cryptomenorrhea. What is this definition? Occurrence of menstrual symptoms without external bleeding. Menstrual blood fails to come out from the genital tract due to obstruction in the outflow passage. Causes are congenital and acquired. Congenital causes are imperforate hymen is the most common cause, and the second congenital cause is transverse vaginal septum. Acquired causes are cervical stenosis following amputation, cauterization, conization. Let's see the pathology. If blood collects in the uterus, it is hematometra. Blood collects in cervix is hematocolpos. Blood collects in fallopian tube, hematosalpinx. This is uterus, cavity, vagina, imperforate hymen. Symptoms: patient chromosome number is 46XS, that is gonads equal to ovaries, which is normal. Secretes estrogen, even this is normal. Secondary sex characteristics will be normal. In cryptomenorrhea, a female with normal secondary sexual characteristics complains of primary amenorrhea. History of cyclical abdominal pain is present. Patient may complain of urinary symptoms as hematocolpos, can also cause pressure symptoms. Patient may complain of urinary symptoms as hematocolpos can cause pressure symptoms. On examination, a tumor, dull on percussion, is found in lower abdomen, partly due to distended vagina and partly due to overfill bladder. Key points: in a normal looking female with normal secondary sexual characteristic, always rule out cryptomenorrhea. Local examination, on separating labia, bluish bulging hymen is seen. Per rectal examination shows uterus is present. Key points: never do PV examination in a virgin females. To know whether the uterus is present or absent and to access the size of the uterus, do a per rectal examination, never per vaginal examination. Management: urgent surgical management by giving a cruciate incision on the hymen. The collected blood automatically drains out.